By the end of today's session, then, you should all hopefully be able to achieve the following things. First of all, identify the functions of the skeleton and the specific different types of bone that make it up. You should be able to explain the structure and function of the bones of the axial and appendicular skeleton. That'll include labeling all those bones and knowing which one's which. And finally, explain the structure of bone. And that is obviously different depending on which part of the skeleton we're looking at, or which classification of bone we're looking at, I should say more specifically. Before really delving into the skeletal system itself, I just want to introduce this slide here. And we need to take note of the positions which both individuals are stood in. This position, stood upright, feet facing forwards, palms facing forwards with arms by side, is what we call the anatomical position. So what you should hopefully note is in textbooks, when they're displaying the anatomy of the body, the illustrations will hopefully be in this position. It is from this position that we will describe all positions of the body. And that could relate to specific positions of internal structures, such as bones or bony aspects. But also when we get on to movement, we will describe some movements using some of these pieces of terminology. So I'd like to run through a few of the terms that are seen on this diagram here. And this will definitely become important for you all during assessment 2, specifically with learning outcome 4, where you will be graded upon the appropriate use of terminology. So when looking at your movements and analysing it, these are some of the terms we should be using. Okay, if we start with the female, couple of key terms to look at there. Lower leg, and it's also illustrated on the limbs, but lower leg's nice and clear. We have two terms there: distal with an arrow pointing down, proximal with an arrow pointing up. We use these terms distal and proximal to describe position in terms of how close it is to the center line of the body. So we use this in the limbs. If we're looking at a distal aspect of a leg, it tends to be further away from the hip. So we could use an example. If you suffered a tear to your quadricep muscle on the front of the thigh, if it was a distal tear, the tear would have occurred closer to the knee. If it was a proximal tear, that then becomes closer to the body, and that would have occurred in the upper thigh region towards the hip. Okay, so distal tends to be further away from the body, proximal closer to the body. The next one we will look at on this diagram, the female, we've got the perforated center line of the body. We've got a term pointing away from it, which says lateral, and a term pointing towards it, which says medial. So if something is medial, it tends to be closer to the middle of the body. If it is lateral, it's further away. This term we may come across, and you might be familiar with it already, and it's certainly something we'll come across probably next week or the week after, when we start looking at the joints of the body. In your knee, you've got ligaments, the LCL and the MCL, the lateral collateral ligament and the medial collateral ligament. The medial collateral ligament, closer to the midline of the body, so that is the ligament that runs on the inside of the knee. Lateral collateral ligament, further away, so that is on the outside of the knee. So there, straight away, we see accurate use of these terms. Next one. This is illustrated on both diagrams, just to the right-hand side of them. We have superior and inferior. Superior if something is towards the top of the body, inferior towards the bottom. You may have come across this in previous study when you looked at the cardiovascular system. The major vein returning blood to the heart is the vena cava. There are two aspects of that. The superior vena cava, which returns blood from the upper half of the body to the right atrium, and the inferior vena cava, which returns blood from the lower portions of the body to the right atrium. Next key bit of information anterior and posterior. So if we're looking at the diagram of the male, we can see those two arrows. Anterior refers to the front of the body, posterior refers to the back of the body. Again, this might be some terms that you've come across before. If you remember when you've studied the muscles, the deltoid muscle, which is one of the major shoulder muscles, split into three aspects: front, middle, and rear. The technical term for the front deltoid would be anterior deltoid because it sits to that anterior aspect or to the front of the shoulder joint. And the posterior deltoid would be the rear deltoid, okay, that sits to the sort of reverse on the back side of the body. Another term you may be familiar with is the posterior chain, which refers to a whole number of muscles that run down the back of the human body. All right. These are terms then: superior, inferior, anterior, posterior, medial, lateral, distal, proximal. We'll try and use frequently throughout the lectures for this module, and certainly something that you should start to try and become familiar with and start using when possible, because if you can get comfortable with that, that's only going to be a benefit for you when you come to do assignment 2. The human skeleton fulfills a whole range of key jobs for us. Some of these the bone tissue itself does, some of them the skeleton as a whole helps to do that. So we'll run through those 6 key functions here. The first one being support. Sometimes people might say structure or shape, but it kind of all comes under this one broader term of support. Now, the bones themselves serve as the key structural framework for the body. It is from the bones that everything else hangs, and it is from the bones that the human body gains its distinct shape. The layout of the bones give us that framework. The soft tissues of the body are attached to the skeleton in some way, shape, or form, so they are supported in place. The bones themselves provide attachment points for tendons and therefore indirectly to nearly all skeletal muscles, and also directly to some skeletal muscles. So in partnership with those, it can support the upright structure that we have and also holds all number of other organs in place. The second function is a very, very important one, and that is the role of protection. Bones protect many internal organs from potential injuries that may occur. And so what we find is, in general, wherever there is a vital organ, there is a bony structure in place to protect it. So some key examples. The cranium completely surrounds the brain and protects it from any external impact. The vertebrae protect the spinal cord, which runs through the center of it all. The rib cage protects, or the rib cage plus the sternum, to form the thoracic cage, protects the heart and the lungs, which are encased within it. Important jobs, because if any of those organs are damaged, that could be catastrophic, potentially even life-ending. So that's really, really important. And generally what we find is in those areas, we sacrifice the degree of movement afforded by the skeleton in favour of protection. So, for example, the cranium, there's very, very little movement between the cranial bones, if any at all, but that means it does a much, much greater job of protection. The thoracic cage, so that's the ribs and sternum, there is some movement in there. We need movement in that area for breathing. The chest cavity needs to be able to expand in order to help the lungs expand and fill of air. So we aren't fully encasing the organs between there. So that does reduce the possibility of sort of fully protecting them and slightly increase the chance of injury, but it is fairly rare. Similar, the vertebral column, if it was a solid tube of bone, the spinal cord would be much better protected, but we need to have some degree of movement in there, so it is split into separate sections with the intervertebral discs, which allow for movement to occur. On that note, the third function is for movement. So what I would say is that this isn't something the skeleton itself does. It's something the skeleton works in partnership to assist with the muscular system to allow for movement. The skeleton, obviously, as we know, isn't one solid piece of bone in shape. There is a number of bones, and every time one bone ends and it meets another bone in what we call a break in the continuity of bone, we have a joint. So, for example, where the upper arm bone, the humerus, ends and meets the radius and ulna of the lower arm, we get the elbow joint. So a joint will allow some movement to occur. The bones also allow for the attachment of muscles to them via tendons. And so when a muscle contracts, it pulls on a bone and can produce movement at the joint which it crosses. So a very, very close partnership there. The fourth function is mineral storage. In fact, not just storage. You may see it termed in some places mineral homeostasis. Bone tissue stores several minerals. In particular, you'll all be aware of this: calcium in large amounts. We relate calcium to bone strength quite closely. Also phosphorus, which contributes to that density of bone too. So they are stored in large amounts in the minerals. But the bones can release those minerals into the bloodstream as well. Minerals serve many, many purposes in the body. So, for example, that calcium that we know we want to pack into the bones for strength is also crucial in the contraction of muscles. So when we don't have enough of these minerals in the bloodstream, the bone can release them. They can be transported to elsewhere in the body where they're needed. Obviously, that's not ideal because that will cause a reduction in the density of bone, but it will support the other substances. So it isn't something that's important we maintain appropriate levels of mineral intake through our diet so we can maximize bone density and also facilitate those other important reactions and structures in the body. Function number 5, blood cell formation. Within particular parts of some of our bones, we have a tissue called red bone marrow. And red bone marrow produces red blood cells, white blood cells, and platelets, all of which are key aspects of our blood. You'll cover that on. You've probably covered that before on your previous studies, but we will also go over that in semester 2 during the physiology of human performance module. Crucial job though that those cells are all created through the process of hemopoiesis. Now that is, the technical term for blood cell formation. The red bone marrow is one of 2 different types of bone marrow that we have. The red bone marrow itself is generally found within the spongy bone of long bones in a particular location. So that reproduction of blood cells is crucial. Blood cells have a limited lifespan. They, for want of a better phrase, wear out and die over the space of days, and performing exercise exacerbates that damage and reduces the lifespan. So it's crucial that we continue to make those blood cells, and the role of the bones within that is very, very important. The final key role of the skeleton then is in energy storage, and energy in particular in the form of triglycerides or fat stores. In newborns, all bone marrow is red bone marrow and therefore involved in that blood cell production. However, with increasing age, blood cell production decreases and a lot of that red bone marrow changes to yellow bone marrow. This consists mainly of triglycerides, so fats that we can store and can be released into the body for energy. Now, this yellow bone marrow is found in the center marrow cavities of the long bones, and it does need to be differentiated because it's in a different location to the red bone marrow in adults, and like I say, this is a fat store. It does not have a role in blood cell production. Almost all the bones in the human body can be subclassified into one of the 5 different types you see on the screen here on the basis of its shape. So either long, short, flat, irregular, sesamoid. Long bones then, roughly defined as a bone that has its greater length than width, and they always consist of a central bone shaft, which is the longest aspect, and a number of extremities, a number of ends to the bone. Long bones are generally slightly curved, and this helps improve the strength of the bone. A slightly curved bone will better absorb the stress that's put through it. For example, your own weight acting down, or a shock force coming up after you land on the floor while running or jumping. The curve helps evenly distribute that force that goes through. If it wasn't curved and the bone was straight, that force going through the bone wouldn't necessarily be evenly distributed. It would act on different parts of the bone unevenly and would therefore place it at greater risk of breaking. The long bones themselves are mainly made of compact bone, and that'll form the major length of the bone. However, at each end they will also have a large amount of spongy bone tissue. Okay, that's going to help with shock absorption and protection of those bones. And we'll discuss compact and spongy bone a little later within this presentation. Examples of long bones are the femur, tibia, fibula, humerus, radius, ulna. Phalanges are a good example too. Phalanges being the bones of your fingers and toes. People will often classify them incorrectly because lengthwise they aren't long, but it is the shape of the bone that's important, not the overall length. And the phalanges in your fingers share the same general shape as radius and ulna. They are longer than they are wide, with the shaft and the ends of the bone. So they fit into the long category. Short bones are almost cube-shaped, roughly equal in length and width. They're mainly spongy bone tissue, except for the surfaces, which are made of compact bone to add, a certain degree of protection. Key examples of the short bones are the bones in the wrist and ankles, which are called the carpals, being the wrist, and the tarsals, being the ankle. A key exception to that is the calcaneus, which is the heel bone. That will be classed, and we'll come to that in a little bit, as an irregular bone. And I'll mention in particular why. Flat bones are generally very, very thin. They're composed of 2 layers of compact bone, which sandwiches a thinner layer of spongy bone tissue in the middle. Flat bones give a large amount of protection and give a large surface area for muscular attachment. And that's why with the examples we often see them in those key protective areas that were mentioned on the previous slide. So the ribs and sternum, as illustrated on the picture here, being flat bones, the cranial bones surrounding the brain, and also the shoulder blade or scapula is also a flat bone. Our next bone shape is irregular. Irregular bones, fairly simply, do not fit the other categories we've mentioned here. So they have pretty complex shapes, and as a result they vary in the structure in terms of how much spongy bone and how much compact bone is in there. They are generally shaped specific to the role they have to play. So for example, we mentioned the calcaneus, the heel bone, just before. That's an irregularly shaped bone to play that key role that the heel has to do for us in terms of striking the ground, and also as an attachment site for the Achilles tendon. Other key examples, the facial bones, as we see on the diagram here, also the vertebrae have irregular shapes. Our final bone shape for classification here is a sesamoid bone. Okay. Sesamoid bones develop inside particular tendons, and this tends to happen where there's a lot of friction, a lot of tension, a lot of physical stress, which could cause damage to those tendons. All right. The number of sesamoid bones that we all have can vary from person to person. They're usually very, very small. And so, for example, in a place where we have tendons run very, very close to the bones, such as the feet or the hands, a sesamoid bone will begin to form within there. They're going to protect that tendon from wear and tear where it rubs across the bone very clearly. And sometimes it might slightly change the direction of pull that a tendon does to give it a mechanical advantage at a particular joint. The key exception with these sesamoid bones, from what we just said, is that we all have two particular sesamoid bones, and they are our kneecaps. So our patellas. Large sesamoid bone that forms within the patella tendon over both knees, and will be present in almost everybody. And as we've already said, sesamoid bones grow inside tendons. So a newborn baby will not have patellas already, they grow over time. All right. One additional bone shape or bone type that isn't being included here, and it isn't really classified by its shape, is a sutural bone. And this is identified by location. All right. The sutural bones are very, very small bones that are found within certain joints called sutures. We will look at joints in a week or two's time. Suture is a type of immovable joint where the bones are joined very, very tightly together by tough tissues, so no movement occurs. And we get them in between the bones of our cranium, so in our skull. And there may be very, very small bones within those sort of connective tissues. The number varies from person to person, and there aren't specific ones that we need to be aware of or need to be able to identify. There are 206 bones in the adult skeleton. They can be subclassified into two major divisions, those being the axial skeleton and the appendicular skeleton. The axial skeleton consists of 80 bones, and they run down the longitudinal center line of the body, or the axis of the body, hence the name axial. So that's going to include all the bones of the skull, the cranium and facial bones there. It includes all the bones of the vertebral column and includes the bones of the thoracic cage. Okay, we will look at all those areas shortly. The appendicular skeleton therefore has 126 bones, and these are the bones that, for want of a better word, hang off the axis. So they consist of both limbs, the two upper limbs, the arms, the two lower limbs, the legs, plus the girdles that attach the limbs to the axial skeleton. And again, we will look at each of these areas over the next few slides. The human skull sits atop the body on top of the vertebral column, and it's made up of 22 different bones. The skull can be split into two key sets of bones. We've got the cranial bones and the facial bones. Cranial bones create the cranial cavity within which the brain sits. The facial bones, create the key features of our face. Altogether, there's a number of functions that the skull really performs. Number one, we've already mentioned this in this presentation, is protection of the brain. So the cranial bones surround the brain and provide that hard, bony layer of protection to stop any external injury. Second key function is the skull supports most of our sensory organs. So the vision within the eye sockets, taste with the tongue sitting within the mouth surrounded by the jaws, the sense of smell within the nose, and hearing with the ears. So there's a lot going on in terms of supporting them. In addition, it is through the skull where we have an intake of both air and food, therefore supporting vital function. The various bones of the face provide attachment site for facial muscles, of which there are a lot that allows us to create facial expressions. It allows us to speak, to eat, and again, really key, important functions for the body. Finally, the bones specifically of the two jaw, the maxilla and mandible, provide the attachment sites for the teeth. We don't necessarily need to know all of the bones of the skull. Some key ones to mention here. First of all, maxilla being the upper jaw and mandible being the lower jaw. We can see the nasal bone, which forms the basis upon which the nose is situated. The frontal bone being the forehead into the top of the head. The zygomatic bone is your cheekbone, with the zygomatic arch being the quite prominent feature of your cheekbone. Sphenoid bone just above that. We have the parietal bone forming a very, very large portion of the lateral aspect of your cranium. Occipital bone being the back of the head, and the temporal bone being to the side. Probably a little bit bigger than most of you thought. Another bone to mention, just illustrated in the small diagram on the bottom right, is this is within the skull really, the hyoid bone. Hyoid bone being a bone that helps support the tongue in its position inside the cranium. Just a minor bit of interest, the hyoid bone, a bone that's sometimes featured in some of your sort of crime documentaries. Hyoid bone shows up often in, crime dramas where someone has been strangled to death. The hyoid bone will be broken in those situations. All right, useless bit of information, not massively important for us in the study of sport and exercise. The vertebral column, that may more commonly be known as the spine or backbone, very simply, is a collection of 26 bones which can be divided into 5 key regions. One of the key jobs is the supporting of the head and together with the thoracic cage, so the ribs and the sternum, the trunk of the body, and holding them in position and giving us that shape. Potentially, its most important is in protection of the spinal cord. The spinal cord being a bundle of nerves, and which job is the transmission of information from the brain out to the organs and the extremities of the body. Should the spinal cord be damaged, it means messages cannot get to regions of the body and other key functions cannot be performed. That's why it's crucial that it be protected. So, for example, if someone did damage their spinal cord or severed it completely, what you'll find is, generally speaking, there would be a loss of function in the body below that point. So if the spinal cord was damaged in the lower back, an individual may lose function within their legs. If the spinal cord was damaged severely in the neck, an individual may lose, control of all 4 limbs as a quadriplegic. So the protective role is very, very important. What we do need, however, is some degree of movement. So as well as being a very strong sort of rod that holds the body upright and protects that spinal cord in the middle, it also has to be able to move and provide quite a large degree of flexibility to allow us to bend both forwards and backwards, side to side, and also rotate too. And the way the vertebral column is broken down into the separate vertebrae, each with a joint in between, really allows it to do that. The vertebral column makes up about 2/5 of your total height. In a man, the average is roughly 71 centimeters in terms of vertebral column length. In a woman, roughly 61, so a 10 centimeter difference there. In between each of those vertebrae, we have what's called an intervertebral disc, forming a very, very strong joint. So the intervertebral discs are made of cartilage, and there's 2 key layers. The outer layer, which is very tough and fibrous to give the cartilage, to give the disc some strength. The inner layer is a much softer, elastic substance. That's really going to play a couple of key roles. We get very, very strong joints, but we also get the ability to absorb shock by having the, for want of a better term, squishy substance in the middle. All right. Above the sacrum, the intervertebral discs are making up about a quarter of the length of the spine. So it's fairly significant in terms of the amount of disc space that we have there. Now, really, really key that they allow us to perform movement. So each joint will allow a small amount of movement, but when that is summated, so if we get each of the joints within the lumbar region of the spine, for example, all perform in flexion and bending forwards, we can get quite a large degree in total, but just one joint on its own wouldn't allow much. The movement occurs because when compressed, when force applied to those cartilage discs, they'll flatten, broaden, and even bulge out of the space they are in, and allow the bones to move accordingly. The danger can be under too much force, under too much stress, those discs can be forced completely out of space, and we can get what's called a slip disc or herniated disc. In severe cases, they may need to be surgically repaired. Nowadays, fake discs can be put in the back. In some cases, however, a disc may be removed altogether and the two bones fused together. The impact of that would be we would lose both a little bit of height and also lose some degree of movement from the spine. Now, the spine is split into those 5 key sections, each with its own name and each with a differing number of vertebrae within it. So the cervical region of the spine is the first 7 vertebrae from the top down. They will commonly be given a name C1, C2, down to C7, so they can be identified. And that forms our neck. Okay, smallest vertebrae, and we get some, key movement within there to allow us to manipulate the position of our head. The thoracic region next would be the upper back. 12 thoracic vertebrae, and that relates to the 12 pairs of ribs we have. So each pair of rib will attach to a specific vertebrae, and again, they will be termed from T1 down to T12 to allow them to be identified. The lumbar region is our lower back. In here we have 5 vertebrae, and they'll be named from L1 to L5. The lumbar vertebrae are the largest vertebrae, and as such they also have the largest intervertebral discs. This therefore gives us the biggest range of motion that we have within the spine, but it also means that the lower back is often a key area that can be subject to spinal injury. So the intervertebral disc between L4 and L5, that's the bottom 2 lumbar vertebrae, that will be the area that is quite often injured in terms of a slip disc. It's got the biggest space between the vertebrae, so more room for that intervertebral disc to be misplaced. Below that, we have the sacral region, or the sacrum, also called. Now, the sacrum, as it says on the diagram, 5 fused vertebrae. So early in our development, they are separate bones. Over time, that cartilage solidifies into bone, and we get one solid plate of bone. And the sacrum is the point at which the pelvis and our hip bones are anchored to the vertebral column. Below the sacrum is the coccyx, 3 to 5 fused vertebrae, so that could be different in different people. You may have 3, 4, or 5 vertebrae there. And again, this is another region where those bones fuse together to make one solid piece of bone. In the female skeleton, the coccyx points inferiorly, so points downwards. In the male skeleton, the coccyx points anteriorly, so that means it points slightly forward, so curves forward. The difference there can be that I can open up the birth canal and make childbirth easier for a female. Another really, really important feature of the vertebral column to mention is those regular curvatures within the spine. 4 key curves to give it a slightly S-shaped appearance, and the role of the curves really is it increases the strength of the spine, It helps maintain balance, in particular helps locate the head quite statically on top of the vertebral column. So regardless if we are moving, the head stays fairly still. It absorbs shock, like a curve can give slightly, and as such of all those things, it helps protect the vertebral column from fracture and therefore supports its role of protecting the spinal cord inside. The thoracic cage then is formed by the bony structures of the ribs and sternum. The key role there, as we mentioned earlier, is the protection of the vital organs within it, the heart and the lungs specifically. Also, the ribs help prevent the collapse of the lungs during respiration by being an attachment point for the membranes of those lungs. There are joints in here, sternocostal joints. So these, on the diagram, you can see the grey areas. They are indicating cartilage in between the sternum and ribs. It is at those points where some degree of movement can occur, and that's key to allow the chest cavity to expand during the process of breathing. The sternum, also known sometimes more commonly as the breastbone, is actually split into three distinct different bones. You have the manubrium, which is at the superior aspect. Remember from earlier, that's the top. The sternal body in the middle, and the xiphoid process at the inferior aspect, so the bottom of the sternum. Xiphoid process would be the area, if you were doing CPR, you would use that as a location point, and then move further up from the xiphoid process to the center of the sternum. Small fact about the xiphoid process, it doesn't fully ossify, so it doesn't really solidify in the bone until roughly the age of 40, and can be damaged as a result. So for example, we've mentioned CPR. If someone did CPR in the wrong location and pressed down on the xiphoid process, it could break and actually be pushed down into the internal organs below it. The ribs are laid out in 12 pairs. And again, as just mentioned before with the vertebral column, each pair of ribs attaches to one of the thoracic vertebrae at the back of the body, the posterior aspect of the body, and attach either directly or indirectly to the sternum in the posterior aspect. Ribs 1 to 7 from the top down are sometimes called true ribs. These have their own piece of costal cartilage which attaches directly to the sternum. The remaining 5 ribs are also known as false ribs. These either share cartilage that attaches to the sternum or have none at all. So the first 3 pairs of false ribs have shared cartilage. You can see it joining together there on the diagram and then coming up together to join to the sternum. The bottom 2 pairs of ribs have no cartilage, do not connect to the sternum, and therefore only connect to the vertebrae at the back. The key job really of the ribs is to support the process of breathing and form the rest of that cage to make the protective role. Having now covered the axial skeleton, we will move down to the appendicular skeleton. So, reminder, appendicular being the limbs and also the girdles which attach those limbs to the axial skeleton. We have the pectoral girdle, also known sometimes as the shoulder girdle, and the pelvic girdle, which helps form the hip joint. The pectoral girdle attaches the arm to the axial skeleton. It is made up by the clavicle, also known as the collarbone, and the scapula that we commonly know as the shoulder blade. The clavicle then sort of helps to create the shoulder capsule, so the joint for what we commonly known as the shoulder, the ball and socket joint there, together with the scapula, they'll form a very, very shallow socket within which the head of the arm fits. The clavicle then also joins and articulates with the sternum on the other end. What should be noted is that being the major sort of anchor point in the body, the vertebral column, the pectoral girdle doesn't attach directly to the vertebral column. Instead, it's attached by a fairly complex series of muscular attachments. And what this does allow for is a large range of motion, but it does make the shoulder somewhat delicate, and as such, it needs to be protected. As we mentioned, that pectoral girdle creates a ball and socket joint, which interacts with the humerus, the bone of the upper arm. After the elbow, the arm goes into two bones, radius and ulnar, which are joined together by an immovable joint for the main body of the lower arm, but do move together at the radio-ulnar joint at the distal aspect. After the lower arm, we have the structures of the hand. The hand is split up into these sort of three sections. We have the carpals, of which there are 8 bones, short bones, as we mentioned earlier. They form the wrist. We have 5 metacarpals, which are the major bones of the hand, and then 14 phalanges, which make up our fingers. The 8 carpals of the wrist, there are separate names for all those carpals. At this level of study, however, on sport, we don't really need to know them individually, but you can get them if you look them up. The 5 metacarpals, like I said, form the major aspect of our hand. The ends of those metacarpals being the knuckles when you make a fist, and then the phalanges making up our fingers and our thumb. The lower extremities have a very, very similar structure to the upper extremities, in that we have the pelvic girdle, and then as we go into the leg, we have a single upper leg bone, 2 lower leg bones, and then the foot is structured in a very similar fashion to what we had in the hand. The pelvic girdle consists of a number of bones. We have the ilium, the ischium, and the pubis. The ilium forms the largest aspect of the pelvis, and it's what we commonly think of as our hip bone. The pubic bone joins with, the 2 pubic bones join together at the front, and the ischium forming the posterior aspects of the pelvis as well. Now, what the pelvic girdle does create is a very, very strong structure for the hip joint. Whereas the ball and socket joint of the shoulder had a very, very shallow socket, the hip has a deep socket that the femur fits very well into, and it creates a very, very structurally sound joint. And this is important if we think about the difference in role between our arms and our legs. Our legs are supporting the entire structure of the body on top of them, whereas our arms, we need them to be freely movable to perform all the dexterous things we do on a day-to-day basis. The pelvis is also very firmly secured to the vertebral column, with the ilium joining onto the sacrum at both sides. In the upper leg, we have the femur being the major bone there, and also the biggest bone in the body. The lower leg formed of the tibia and fibula. Tibia being the major shin bone, fibula being a smaller bone to the lateral side, so that's to the outside, and also slightly to the posterior, so behind. Into the foot, again, similar layout. We have 7 tarsal bones that form our ankle, 5 metatarsals of the foot, and then 14 phalanges forming the toe bones. Again, all those tarsals have their own name, and we don't necessarily need to know them all at this level. It's worth knowing that the calcaneus is specifically the heel bone, and then the malleolus being the sort of the notches we feel on each side of the ankle. Medial being on the inside, lateral being on the outside. The one addition to add into that is the sesamoid bone we mentioned earlier, being the patella or the kneecap. That forms within the patella tendon, helps protect that tendon from wear and tear when it crosses the knee joint, and also helps create a longer lever angle to give mechanical advantage to the knee to make it more efficient joint during movement. Bones are classed as a connective tissue in the body, and as such they contain what's called a matrix of intracellular materials surrounded by widely separated bone cells. So the matrix is formed of roughly 25% water, 25% proteins such as collagen, and 50% crystallized mineral salts. That protein, the collagen there, that really serves to give bones a lot of tensile strength, and it means they are less brittle than if they were just mineral based. So other calcium based structures can break a little bit more easily under stress, whereas that additional collagen layer makes the bone a lot stronger and able to put up with the wear and tear we put it through and the stresses and strains we put it through. Of those sort of mineralized sections, majorly calcium and phosphagen stored. And as we have to remember from earlier in this presentation, it is a store of those minerals and they can be released. So whilst they are crucial for the strength and density of the bone, they are used elsewhere, and if required, they will be mobilized and released into the bloodstream. Aside from that matrix, we then have roughly 35% of the bone being living cells, and there are some key different types of bone cells within there. Osteocytes, osteoblasts, and osteoclasts. Osteocytes are the mature bone cells, and they're the major cells within our bone tissue. They are derived from osteoblasts that get trapped in the matrix of the bone, and they no longer carry out daily cellular activities of bone tissue that the osteoblasts will do, as we will mention shortly, and they become calcified. So they become hardened by the mineral salts and become absorbed as, standard bone tissue. Osteoblasts are bone building cells. So they synthesize and secrete collagen fibers and some of the other key organic structures that are needed to build the bone matrix within which everything else sits. And they also initiate calcification. So that is the hardening of those mature bone cells to become solid bone. Osteoclasts are much bigger bone cells. Their key job is the breakdown of bone. So they release enzymes and acids that digest the proteins and minerals of bone, which can then be absorbed back into the system. This is an important function. We'll look more specifically at bone growth and bone redevelopment next week. But as a living tissue, bone has to be continually broken down and rebuilt. If it wasn't broken down and rebuilt, bone would become weaker over time and would be at risk of damage. So the careful balance of osteoblasts building bone and osteoclasts breaking bone down is crucial to maintain a solid functional skeleton. We're now going to finish off with a little bit of a closer look at the structure of bone. And we'll do that in two different parts. Firstly, here for the long bone, and on the next slide, we'll look more specifically at how flat, short, and irregular bones are made up. One of the key parts of that is going to be the two specific types of bone tissue. With long bones, then, there are a number of key aspects to the bone. If we look at those terms on the right hand side of the diagram, we have the diathesis, which is the shaft of the bone. That's the long cylindrical part and is the main aspect of the bone, given it its length. We then have at each end an epiphysis, proximal, being towards the centre of the body, distal being at the other end. They are the ends of the bone. In between the epiphysis and the diaphysis is where we have what's called the epithesial disc. That is in an immature bone, so a bone that hasn't finished growing yet. So the epithesial disc is a layer of cartilage. Cartilage, like other cells in the body, divides. So cellular division is the basis of growth, really. So a cell divides and both cells then grow to the size of what the original one was, and this continues to happen. Through this process, bones can grow in length and width, and again, bone growth is something we'll look at next time. Over time, that epithesial disc closes and it becomes what we call a metaphysis. So that is now just solidified bone and there is no longer any growing taking place. At that epiphysis as well, on the end, we have a layer of what's called articular cartilage. This is a thin layer of cartilage. We'll look much more closely at it when we do joints, either next week or the week after. The role of the articular cartilage there is to reduce friction between two bones when they meet at the joint and also absorb any shock should those two bones clash together during movement. So it's really, really there to make movement much easier, much more efficient, and certainly pain-free. We have the periosteum of the bone, which is a tough sheet of connective tissue surrounding the bone surface, wherever not covered by cartilage. It contains some of those bone-forming cells, the osteoblasts we discussed earlier, which allows bone to continue growing in diameter and thickness. It also key in that it helps protect the bone. Should there be damage to the bone, it helps in the repair and it helps nourish the bone tissue with the blood vessels coming into there. The endosteum is a membrane in between the periosteum and the bone tissue, contains more of those osteoblasts and also surrounds the medullary cavity. The medullary cavity is a hollowed section in the center of the long bone. And that space is filled with the fatty yellow bone marrow we mentioned earlier. So that's a triglyceride store. It can be a store of energy. Now, within that long bone, we have sections of spongy bone and sections of compact bone. The compact bone forms most of the diaphysis, so the shaft of the bone. The spongy bone is found in those ends in the epiphysis. It is within the spongy bone, or the gaps within the spongy bone, where red bone marrow is formed. And if you remember from earlier, it's within the red bone marrow where our blood cells are formed. Okay, and we'll look specifically at compact and spongy bone on the next slide. Here then we can see the structure of, in this instance, a flat bone from the cranium. But this would be very, very similar if it was on the short bones or one of the irregular bones. We have on the outer edges a thin layer of compact bone with a layer of spongy bone sandwiched in between. So from the picture there, we can see the clear differences between those two different types of bone tissue. Compact bone, although it does have small spaces in between its hard components, they are very, very few and far between and very, very small. Compact bone therefore makes up the outer layer of all the bones and certainly the bulk of the diaphysis of the long bones, as mentioned on the previous slide. The compact bone is really there to provide protection, support, and resist the stresses that are put upon it by the weight it carries and the movement that occurs. In contrast, the spongy bone tissue has this irregular sort of latticework framework in the middle, okay, with much bigger gaps in between the bones. So these spaces within the spongy bone framework is where the red bone marrow is found, which is the site of red blood cell, blood cell production in general. Um, Spongy bone, because of where it's found here, like I said, in the center of these flat, short, and irregular bones, and also in the epiphyses of the long bones, actually makes up most or a large amount of bone tissue in the body. Um, One of the key benefits, as well as housing that red bone marrow, it also reduces the weight of the bones, which makes them easier to move. And as much as the framework in the middle there seems very, very haphazard and less organized, it's actually laid out in a specific way in relation to the lines of stress when forces go through that. So that really helps the spongy bone resist stress, but also because of the branches coming out of it, transfer force in different directions without breaking. Um, and this is really, really important with it being in the ends of the long bones where force is transmitted through, for example, every time you take a step or run or jump.